This is an in-service program presented by Nutrition Care Systems. Today's topic, feeding a resident who needs assistance. Upon completing this in-service, you will number 1, state 3 reasons why long-term care residents may require feeding assistance. Number 2, understand how to properly set up a tray for an independent eater. And number 3, describe the basics of safe feeding techniques. Now, there are some signs that a resident might need some feeding assistance, and that would be poor meal intake. Maybe they have a lack of interest in meal trays, they have some type of cognitive impairment, or maybe a physical inability to eat. They're not able to use their arms, or they have tremors that prevent self-feeding, and they may have vision problems that prevent self-feeding. So the benefits of feeding a resident would be increased oral intake with a potential for an improvement in their nutritional and their hydration status, and also mealtime interaction with the staff. There may be different levels of feeding assistance. First might be tray setup only, meaning they just need a few things set up for them, but then they can take it from there. Limited assistance that might include cueing, assisting with the end of a meal, and encouraging them to complete their meal, or feeding only certain food items. Restorative feeding program where the resident is encouraged to eat for themselves with assistance provided as needed, or the resident is fed totally by the staff. Now there's different tray setup techniques. Obviously the first is to wash hands. Make sure silverware is accessible for the resident. Open their milk cartons, their salt packets, cracker packets, things like that. Butter their bread and season the food as needed. Cut meats or breads if needed, and cue the resident to eat if they're needed. Ask the resident if there's anything else they need before moving on. Please treat your resident with dignity and respect. Assure the proper positioning of the resident. Make sure you feed the resident small bites at a time. Don't rush them. Alternate liquids with solids. Do not mix foods together. It might be easier for you, but it just does not look very appealing for the resident. Cue the resident to open mouth if necessary, and then record the intake as soon as possible after feeding the resident. Let's take a short quiz. Question number 1. Which of the following is not a sign that a person may require feeding assistance? A. Lack of interest in meal trays. B. Difficulty getting a fork to the mouth due to tremors. C. Eating 100% of meal trays. Or D. Vision problems. And the answer to question number 1, which of the following is not a sign that a person may require feeding assistance? That would be C. If they're eating 100% of the meal trays, they do not need feeding assistance. Question number 2, which of the following tasks is part of tray setup? Wash hands before touching the tray, open milk cartons, assure silverware is accessible to the resident, or all of the above? And the answer to question number 2, which of the following tasks is part of tray setup? And the answer would be D, all of the above. You want to make sure you wash hands, open the milk cartons, and assure silverware is accessible to the resident. Question number 3, which is usually true of residents who require feeding assistance? A, they are usually cognitively impaired. B, they have lack of interest in meals. C, they are usually physically impaired. Or D, all of the above. And the answer to question number 3, which is usually true of residents who require feeding assistance? And that would be D, all of the above. Question number 4, true or false? Feeding a resident can result in an improved meal intake. And the answer to question number 4 is true. Question number 5. When feeding a resident, you should mix foods together for easier consumption. And the answer to question number 5. When feeding a resident, you should mix foods together for easier consumption. The answer is false. Thank you for your participation in today's program. Our goal is for you to use this information in your daily work. We hope you are well served today and every day. If you would like more information about our in-service programs or consulting dietitian services, please contact us on the web at nutritioncaresystems.com.